Welcome back. My name is Dr. Baird, and today I'm going to help you develop a better understanding of the causes of low back pain from a strength perspective, and hopefully show you why strength training is not only the best thing you can do to overcome chronic low back pain, but also keep active and build confidence in your body's ability to do the things that you love, because that's what's most important in this whole thing. It's not the pain itself, but it's how the pain is impacting your ability to enjoy the world around you. And that's where strength training really sets itself apart from any other therapy. So before we get started, I wanted to orient you to the anatomy of our spine and go over the things we call them pain generators, the areas in your low back that your pain might be coming from. So first and most common are these intervertebral discs. So these are our vertebrae, and in between each one we have what are called intervertebral discs. These are the things that take most of the compressive load of everything that we do throughout the day. When our discs are injured, usually it's kind of dull, it's kind of achy, it's hard to localize. It's usually, again, this is a general pattern, kind of made worse when you bend forward, or again, you sit at a desk and you kind of have that slouched posture for most of the day. What that does is, again, it flexes our spine a little bit, and you can see if there's an injury down there, how that's going to compress those intervertebral discs and can make your pain a little bit worse. The second most common area to get injured are these joints on the back of the spine. So here's one, a little bit harder to see, but they're on each side. These are called your facet joints. When you injure these, usually it's more of like a pinchy type pain. So when you do a certain activity or get into a certain position, usually it's extension. You can see how when we bend that spine back, how those might compress those joints right there. You're gonna get that kind of sharp, pinchy pain. And that's a sign that it might be those facet joints that are injured. And the third are gonna be your SI joints. So if you reach behind you, you're gonna feel these two kind of bony areas right in our low back right here. Under those, you have what are called your SI joints, and these are held together by, it's a very ligamentous joint. So you have these ligaments that kind of hold everything together down there. And if those get stretched or if those get strained, it's gonna cause pain in that SI joint. Usually you'll feel it kind of on one side more than the other. And fourth is obviously muscles. So again, those are the most common pain generators. There can be others, but if we're trying to simplify everything, those are the four most common areas to get injured in your low back. So now we want to figure out what is the cause of those injuries. So what causes those certain areas to get injured? And again, it's pretty simple when it's something like a car accident or a fall down the stairs where, well, it was that fall down the stairs that caused too much impact on one of these areas, and that's the cause of your low back pain. But for most people, it's not that simple, right? That's not how their back pain came about. Most people that I interview that start with me, they can't really tell you when their back pain started. They can't point to a certain event. It just kind of gradually comes on. Another pattern is it kind of tends to come and go. So they have the back pain, they rest it for a bit, it feels okay, and then it comes back. So what's the deal with that? And so what I want to do with this, again, it's very hard in a YouTube video because, again, it's going to be very dependent on your lifestyle, the activities that you like to do. But in terms of the cause, it can all be summed up in one little phrase. It's too much impact going through your low back over too long a period of time. So I'll say it one more time. It's too much impact going through your low back over too long a period of time. And that's why most of the time people kind of associate this back pain as part of getting older, because they've had these kind of smaller impacts that have now accumulated over time that eventually get to a point that causes pain. So in terms of what we can do to solve that, it would make sense that we learn how to limit the impact that goes through those joints. So if the cause of low back pain is too much impact at the low back, again, it can be any activity, it's just dependent on what your lifestyle is like. What can we do to limit the impact that goes through your joint so that you can get out of pain and back to those activities that you like to do. And this is where strength training really sets itself apart. So there are so many therapies that you can use to get out of pain and kind of speed the healing process, right? Chiropractic, acupuncture, massage, all these things are designed to help pain relief and help speed the healing of these areas. But if we immediately go back to the activity and go back to kind of hammering our low back, it's only a matter of time before it comes back. So you did a good job healing it up, but you didn't do anything to correct the thing that's causing that impact. And so it can be a day, it can be a week, it can be a couple months or a year, but usually that pain starts to come back, and usually as we start to get older, it starts to become a little bit more frequent. That's the most common pattern that I see. And this is where strength training really sets itself apart, because the entire goal of strength training to solve back pain is to teach you how to limit the impact that goes through your low back. And it does it in 3 specific ways. One, it helps train movement patterns. So movement patterns are how we coordinate movements to perform basic activities. How do we lift something up off the ground? How do we go upstairs? How do we reach something in front of us? Those are examples of movement patterns that you really get to practice when you get into strength training, and part of the reason why strength training is so beneficial. 2 is mobility. So how much range of motion do you have in other areas? And again, if you're one of those people who are stiff, what can happen is that your body kind of has to compensate for that lack of range of motion, and a lot of times that mobility issue comes down to our low back. And that's why strength training can also be very important. The strength training is a great tool to actually improve mobility and improve flexibility. And third, and hopefully most obvious, is that building strength helps build stronger muscles that are designed to take the impact of those activities. So again, an unfortunate truth is that once you reach a certain age, usually it's between 30 and 40, we start to lose muscle mass. And so if we're not actively building our muscles, we're kind of passively losing them. And that's why it's so important to have a strength training routine to help us maintain that strength, to make sure that the impacts of whatever activity that we like to do is being handled by our muscles and not going through our discs or our joints or our SI joints. So that, in its simplest term, is the cause of most low back pain. Again, this is untraumatic low back pain. Too much impact that accumulates over too long a period of time. And that's why strength training is going to be the best thing that you can do to limit those impacts, to make sure not only that you overcome low back pain, but that the back pain doesn't come back, and build confidence in your body's ability to do what you love. And that's one of the biggest benefits of strength training, is that confidence piece, so that you can go on a hike, you can go on a run, and feel confident that you're not going to be paying for it 2 or 3 days down the road. So that's all I got for you. I hope that helped you develop a better understanding of, one, the cause of low back pain, and how strength training is going to be something really beneficial to add into your healthcare routine to manage back pain. So again, my name is Dr. Carl Baird. This is Solving Pain with Strength. If you do have any questions, leave them in the comment below. Thank you so much for being here, and I look forward to connecting.